always complained of heartburn. He was self-medicating on antacids, which I would buy as a matter of course with the shopping on a weekly basis. It was August 2002 and he was eating a piece of toast on a Saturday morning and it was sticking, giving him hiccups. Our doctor then referred him to a gastroenterologist who said, "It's cancer." He died at home on the Friday. Mike should never have died. It was completely and utterly preventable had we known that heartburn was linked to esophageal adenocarcinoma. Up to 500,000 people in the UK have the precancerous condition Barrett's esophagus, and they are ticking time bombs, with approximately 50,000 then going on to present with esophageal adenocarcinoma, and this can be prevented through awareness.
Mimi McCord, it's a real pleasure to have you on today's podcast. Thank you so much for giving up your time to be on this.
Thank you, Simon.
Wanted to, listeners have just listened to your intro story, which is a real powerful video for a couple of reasons. Obviously, your heartwarming story, but more importantly, I think it's a real eye-opener for the listeners to understand about your charity, which is obviously what we're going to talk about today. But I think it's something that people, obviously are unaware of. But I think it's just a really powerful video from those perspectives. So really, I just wanted to thank you for letting me use that video for this podcast.
I'm only too delighted, Simon. Whatever we can do to increase awareness of esophageal cancer, particularly esophageal adenocarcinoma, which is the cancer that's directly connected with heartburn. And we know how many people suffer from heartburn and dismiss it as an everyday occurrence. And in some people it is, but in others it is not.
And I think obviously this was the kind of first question for you really is what powered you. I appreciate that, that video people have listened to or watched is kind of supercharged your passion and reason behind starting this charity. But I can imagine it was something that was something of real passion for you to get going.
It is and was and always will be a passion. Mike's death was completely and utterly preventable had we known what heartburn can do. I can't do anything about his death, but I will do everything I can to make others aware that heartburn in some people is not just an innocuous inconvenience.
So let's dive into that question, because I think heartburn, and we've talked about this before, and I think it flows nicely. But signs and symptoms, because this is something that people probably have on a maybe a weekly basis, but just so unaware of. Do you want to just touch into kind of the real depths of signs and symptoms?
Most of us will have heartburn at times, and we can usually put it down to I've eaten too much, I've drunk too much. And there are triggers in some people, but it's the persistent heartburn that carries on, particularly over, for more than 3 weeks. Don't just dismiss it. Don't just pick up another packet of Rennies, or worse, proton pump inhibitors, which can be readily taken off shelves in supermarkets, along with the shopping. I think it is absolutely appalling that something as strong as a proton pump inhibitor under the name of Nexium, for example, can be picked up and taken without challenge from a supermarket. There's nobody there saying, you do realize that this is a strong medicine that will suppress acid, which is what causes heartburn. And all the, whether it's a proton pump inhibitor like Nexium or Renes, which all of us are aware of, it only suppresses, it does not cure any underlying problem. And the majority of people are so unaware of that. They cheerfully, just pick up antacids, whatever they are, from the supermarket and pop them like Smarties, not understanding that persistent heartburn needs to be checked out by a GP.
Yeah. And I think heartburn, and also, is there any other signs and symptoms that potentially someone that hasn't, that's been having heartburn for a period of time, but is there other signs and symptoms that some people may be also experiencing?
The most significant thing, if you have difficulty in swallowing, that is an absolute red flag and needs, you need to see a GP pretty immediately. That is indicative that there is a problem. And some people will have a hoarse cough. Some people might regurgitate food, discomfort behind the breastbone. But it's the persistence of heartburn, and if there's difficulty in swallowing, immediate action must be taken.
Okay, that's helpful. I suppose, who can this affect? I mean, is a big question to ask.
It can affect anybody at any age. Esophageal cancer has a greater incidence in men than women. So the ratio is around about 4 men to 1 woman. So it's a significant increase. The reasoning behind that, I think, is unclear. But we do know that there are factors that can help alleviate heartburn, which in turn can help prevent esophageal cancer.
Okay. And these self-medicators, I suppose, it's kind of would you say it's masking symptoms for them, because it's a kind of a short-term fix? Any of these guys picking up these antacids or the things you mentioned, can that obviously be a case of really masking those symptoms for them?
Absolutely.
Yeah.
And people are just completely unaware that this is what they're doing. It as far as they're concerned, it cures the problem. It removes the acid and the discomfort. And the self-medicators are the people that I am most concerned about, because they are under the cohort, there are a cohort of patients that are under the radar of the GPs. They're not known. We don't know how many people are self-medicating, but it is so dangerous. Yeah.
So we've talked on someone having long-term symptoms. You're saying probably over persistent kind of heartburn or any of those symptoms you mentioned over 2 weeks or more
it's over 3 weeks or more. Okay. That people should be aware that persistent heartburn over this period of time is not normal.
And so the steps for these guys would be what would you suggest? First thing, obviously, GP is their first port of call.
Yeah, absolutely. A GP will be able to decide what the course of action for that patient is. A GP will decide whether they need to be referred for an endoscopy. At the moment, there is only the option of endoscopy as a way of diagnosing if anything is going on in the esophagus.
Yeah.
But the GP will probably give somebody a course of proton pump inhibitors, the PPIs, which I have mentioned,
yeah,
for a short term to see whether that cures the problem.
Okay.
People will also be recommended to look at their diet. Diet plays a significant factor in heartburn. So, as a charity, we recommend being careful of diet, Obesity is a significant factor, and exercise is a big plus in helping people with heartburn. It all adds to fitness.
And that's really interesting, actually. And we've touched on this before about kind of alkaline acidic food. So it's interesting. I know we can talk about this a little bit later and what your charity are getting up to, but acidic foods is a big part, a big cause of people having kind of heartburn issues. So I suppose it goes hand in hand, doesn't it? And that's where you talk about yourself medicating, because it's easy for people to go to that solution because it's built in as a habit. And I suppose that's where you come in to change people's mindsets of actually, if this is an ongoing problem, you need to get it checked. So that's it's really interesting.
I mean, we know that we have a problem in encouraging men to see their GP or to actually acknowledge that they have a heartburn problem that needs to be addressed. Men will be an ostrich if they can be. Women tend to be the gatekeeper of their husband, partners, whatever's health. That's
interesting. I think you're right. Definitely right. Let's go into your charity. So, what's your charity up to now? That might be relating to kind of the partnerships, the message you're getting out there. Let's kind of dive into what your charity is doing.
At the moment, awareness is a key part of the charity. Raising awareness will help promote an early diagnosis. And with that in mind, we are working with Project Delta as their primary care arm. It's a large research study, and we have provided a mobile diagnostic unit as their primary care arm. So the Cytosponge, which is looks like a large pill on a string and is swallowed by the patient, it then opens in the stomach, and it then shows a small sponge, which is then drawn back up the esophagus, taking with it cells. Those cells are then sent to the pathology unit to be looked at to see whether there are any changes in the esophagus from all sorts of changes in the cells, which will indicate Barrett's or esophageal cancer. This is a test that is given by trained nurses in the mobile diagnostic unit. It is quick, it's simple to administer, it's patient tolerant, it's very accurate, it doesn't require sedation, and patients on the whole are extremely happy.
And I think that's fascinating. Actually, it'd be a good point just to cut across to a video now to show you that mobile diagnostic unit in action.
So the patients will be pre-screened before they actually turn up at the mobile unit. They will then come in our reception area, where we will ask them a few questions, and then they will then come through to the clinical room where we'll do the Cytosponge.
Because my throat was quite dry, I was thinking it was going to be a struggle, but actually taking it with water, not too bad at all. It really wasn't too bad. Slightly bigger than I thought it would be, but just like a largish vitamin pill.
It takes a complete skim of the internal layer of your esophagus and collects those cells up, which enables the hospital then to check whether there are any rogue cells in amongst that lot.
This is when HCUK really helped me. They gave me all the information I need, answered questions. They even put me in touch with a consultant who answered questions for me. Yeah, they were just incredible.
They really do, help an awful lot. Their value is phenomenal. They must be saving lives. Without a doubt, they're saving lives.
HCUK has
has been instrumental in spreading a lot of information out there about heartburn and its relation to cancer and its relations to Barrett's esophagus. It offers a resource to find out more about their symptoms and what can be done.
HCUK, like my only lifeline at the moment, they're very, very supportive. They tell me exactly what I need to do, and that is to get the surveillance.
One of the things that has come from my experience is the importance of early detection, because my story is such a good news story.
I always urge anybody who has reflux to go to see their doctor.
I think that's such a great video. It's so powerful. I suppose the next question for you is, where do you want this to go now? Where's the future for this mobile unit?
We want this test to be accepted within the NHS as a standard part of the care pathway.
Yeah.
And we want it sitting in primary care, either in doctors' surgeries or in a community hub. So surgeries can then refer or send their patients to the hub to have the Cytosponge, which is far less invasive than endoscopy, which at the moment is the gold standard way of investigating what is going on in the esophagus. And that won't change, but we want the Cytosponge to be part of triage. So this is the first port of call for a patient in a doctor's surgery or a community setting to see if there's anything going on. And if there is something going on, they will then be referred immediately to secondary care, which is the consultants for endoscopy.
And that's groundbreaking, isn't it? We've discussed this before. It's fantastic. Less invasive, and it's something, your mobile unit, for people listening, obviously you can post some videos in so they can see what that mobile diagnostic unit looks like, and you've got a fantastic video that shows the ins and outs of that. But I think for people listening and knowing that that's available, and your kind of big mission is to try and get that into primary care, is fantastic, because when someone not from medical background but talks about endoscopies, you know, there's always that fear factor of the, you know, potentially invasive of it, and this is less invasive, right?
It's very minimally invasive. It is following a large vitamin pill size capsule. It's a no-brainer as far as I'm concerned.
Yeah.
But we've got to get it into the NHS as an accepted care pathway. And then we will start making a difference to the number of esophageal adenocarcinoma deaths that arise each year.
And where are you along that timeline at the moment? Is it something you think that's coming alive quickly for you, or is it a process that you're still steaming ahead to try and get in?
It is a process, and it's a slow process. Cytosponge has been accepted in NHS Scotland, but we are very slow in England, and COVID, with the backlog of patients who have yet to be seen for endoscopy. The Cytosponge is an ideal way of dealing with patients waiting.
And that mobile diagnostic unit, is it it's currently active at the moment? Whereabouts is that?
It's currently active in Suffolk, in Eye. That's its third and final destination, following we started in Cambridge last June, then went to Chelmsford, and now we're in Eye. Different demographics, completely different, rural. So it was chosen, as I've said, as part of the Delta project, because of all the different demographics that will all add to the knowledge that they're building up on the use of Cytosponge.
Great. I want to touch on if someone is, suffering with esophageal cancer. How does your charity, support them as a process?
We have support groups.
Yeah.
And we also have a very active Facebook support group, and the numbers using that are increasing significantly. But there is support with other patients who've undergone very similar surgery, and a full esophagectomy is not a walk in the park. I mean, it is a nasty operation. And being faced with the fact that you have cancer is difficult, and it's difficult for the patient, it's difficult for the family, and people looking after that patient. It's a tough one. Yeah,
and I think that is a big part of it, because we tend to shy away from the word cancer, and I think we don't talk enough. And having that level of support is really important. And I think actually, looking through your website, and I'm going to make links to that, but it's a very easy site to navigate. People can get all the information they need. So I think that's really, really well done. Your long-term mission, we kind of touched on a little bit. What is it? I'm just saying, just wave a magic wand, but what would you say your kind of immediate changes? What would that be that you'd like to see?
With a magic wand, I want Cytosponge across the UK, literally across the UK. I've said that that it's in Scotland, but it needs to be in England, in Wales. It needs to be everywhere, and that is a game changer.
Yeah, and I think that is a big key, because people listening, that may know someone that's going through this experience will put their hand up and say, "Hey, I want to go and jump into this mobile diagnostic unit. I want to do it." And again, it could be possible, I guess, if they reached out to you guys, but also it's just kind of really suppose getting that full force for it to come down into the UK.
Yeah, it is. Yeah. It's exactly that, because at the moment, Cytosponge in England is only available within a research setting.
Wow.
So it is a game changer. It will make such a difference.
And with that being kind of an immediate change, I suppose signposting to the process, would you say, through GP surgeries, if there's GPs listening to this, is kind of, and they do an amazing job. So I don't like to say this, but it's actually signposting and having that information, that readiness, the understanding, because they can't know everything. But I think, would you say that is a key area as well, is having GPs, surgeries, having more of an understanding? Yes,
it is very easy, particularly in a busy surgery, for patients to be dismissed with it's only heartburn and to be given medication, and then they drift. We don't want patients drifting and carrying on with proton pump inhibitors, whatever the doctor has given them as a prescription that they pick up each month. If it is persistent, it needs to be checked. The GPs need to take it further.
What's your kind of charity up to? What's it up to at the moment for raising kind of awareness? Are you up to any events, if people really want to get involved in this? What are you kind of up to at the moment?
As far as fundraising or awareness?
First of all, let's touch on both. So awareness, have you got certain other campaigns that you're pushing out? And then also on that second part of the question is fundraising.
With regards to awareness, the mobile diagnostic unit is a very good way of raising awareness, and the number of people who have actually seen the unit and it has registered with them. They've heartburn. So that is a very good way of raising awareness.
Yep.
We are working with a project called Cytoprime, and that is another research project in the north of England, and the incidence of esophageal cancer is very high in the north of England and Scotland. So there is this awareness program going on using Cytosponge. But again, as I've said, it is research rather than common practice. But we are working with various golf courses. There was a golf day yesterday at Wolpelston in Surrey, and we had our own team had entered, and there were another two from the Lanesborough. We are a charity of the year at the Lanesborough in London, and that was in memory. Wolpelston Golf Course were doing this golf day in memory of their a past captain who had died from esophageal cancer. So the awareness is constantly there, and we use social media, Twitter, LinkedIn, Facebook, Instagram. So we've got awareness going on through that.
Fantastic.
So that is how we are raising awareness. And the work that is being done in the north of England, we have our HCUK logo attached to it. So we are prominent in the support that we're giving across the country.
That's fantastic. Fundraising, second part of that question. If people want to get involved with certain fundraising, they may well have their own events. Is that something that you're keen to see?
Yes, absolutely. Fundraising in any shape or form that, however wacky, the wackier the better. Because we can get awareness through that. We can get the media involved if possible. Just Giving pages can be put on the website. There are all sorts of ways of fundraising. Some ideas are on the website, but anything that anybody can think of, even if it's making a cake, giving somebody a cup of coffee. If it makes 10p, it's 10p we wouldn't have had otherwise.
Yeah. And I obviously helped you in the past, done some runs and trekked through some muds doing some assault course racing, if you remember rightly. I tried to get you involved in that one, but I don't think you wanted to get muddy.
No chance.
Future for the charity, what's up and coming? I appreciate that, the big drive is mobile diagnostic unit. You really want to get that down and get that moving. Is there any partnerships, anything that, or any other exciting things that you're really trying to work hard on to achieving?
We are working very hard to get another mobile unit.
Great.
But we can only do that if we do have a partnership with, for example, the company that deals with all the pathology for Cytosponge. And we're in conversation with them at the moment. Cancer Alliances are another body that we're looking at to be in partnership with, because we can provide the unit and maintain it, but the cost of the device and the pathology is too much for us as a small medical charity to bear itself. So we do need to have a partnership.
Yeah, I can imagine. I think again, when people see the video posting, it's really exciting. Just touching on if someone is going through this level of support, we just talked about it earlier on with diet and exercise. Is there stuff that your charity is providing in order to help out with people on that advice?
Yes, very much so. On the website, we have a dietitian in residence, and we have a doctor in residence. The dietitian, if somebody has a query about diet, and this can be something from a question regarding heartburn and how to help change their diet so that they can perhaps pinpoint the trigger that's causing the heartburn. But also the doctor in residence, the dietitian in residence is specifically trained for esophageal cancer. So dietetics within, for people who've had that type of surgery is so important. So she has the ability to advise with absolute authority from something as simple as heartburn to something as complicated as recovering from esophageal, a full esophagectomy. And doctor in residence is Dr. Oliver Stovin, who has now just become one of our trustees. And he is able to give a broad outline of what might help a patient with a particular problem, but it will be given as a broad outline rather than specifically tailored for that patient, because any patient with a medical query needs to speak to their own GP. We have two medical trustees. One is Professor Rebecca Fitzgerald, who with her team developed the Cytosponge, and Professor Tim Underwood, who is a cancer surgery specialist. His speciality is esophageal cancer, and both will provide information, support, help as required. So we do have a strong team that can be accessed via the website.
Fantastic. And I think that does highlight, me talking earlier, the website is very it's got so much information, so much level of support, and I think that is people's port of call, and your social media channels as well. Fantastic. And hopefully this video is going to highlight, I'll make reference to all the bits that you've just mentioned. Is there any, before we kind of wrap up this, is there any last kind of message that you really want to relay to listeners, especially if it resonates with them, any of these symptoms?
Please do not ignore persistent heartburn. It can be an underlying problem that you're totally unaware of. And if you're a man in particular, don't ignore it. Don't pretend it's not happening to you. You need to get something done about it, and your GP will advise and help and support.
Great, thank you. And I'll put all the relevant references so people can reach out to you guys. Mimi, that was an absolute pleasure. Thank you so much for taking up the time today to come on to the Wellbeing Coaches podcast.
Thank you very much, Simon, for giving me the opportunity.
Thank you. That was episode 6 with Mimi McCord from HCUK. To watch the full video, head over to our social channels, also where you'll find bite-sized snippets from the full podcast. Thanks again for listening to the Wellbeing Coaches podcast.